And for our next story, let's turn to the United States of America. The mercury is dropping, but infections there are soaring. Have a look at the numbers. According to an analysis by NBC News, America is reporting over an average of 43,000 hospitalizations daily. 43,000. If I speak of the number of patients in the ICU, it stands at 5,302. If I speak of children running the infection, the figure stands at 1,458. And if I speak of the deaths, there was a 44% rise in COVID-19 deaths last week. 44%. A total of 3,907 people lost their lives. And now have a look at this map. It depicts the Wuhan virus hotspots in America. The states where the hospitalization rates are the highest. The state of Delaware, the home turf of Joe Biden, is the worst hit, followed by North Carolina, New York, Connecticut, New Jersey, Massachusetts, Georgia, Missouri, Texas, Nebraska, just to name a few. And if I break it down further, Delaware is reporting to 28.5% surge. 28.5% surge in hospitalizations from last month. North Carolina is reporting 40.4%, Connecticut 26.7%, New Jersey 15.2%, Massachusetts 28.9%, Georgia 39.5%, and Texas is reporting a 20.6% surge in hospitalizations. This is compared to December 2022. This data is distressing, to say the least. The question is, why are the infections soaring? There are three reasons. One, new subvariants of Omicron. They are evolving and spreading at an alarming pace. Reason number two being the rise in travel due to holidays. Thousands of Americans traversed through the country around Christmas and New Year, and this caused a major spike in infections. Reason number three being fewer precautions. Americans have grown tired of restrictions after all this time. Many have thrown caution down the drain. I will tell you how in just a bit. First, let's get to know this variant that is causing this surge in cases. According to the CDC, it's called XBB.1.5. It is a subvariant of the Omicron, which accounts for 43% of the new cases. What exactly is this variant? Experts say it is an offshoot of XBB, which was detected in October. And this variant itself was a combination of two other subvariants, and this makes the new subvariant highly lethal. Experts say it's by far the most transmissible variant of the Wuhan virus. No wonder cases are soaring in America. And that's not all. The World Health Organization has said that this subvariant is likely to spur more cases based on its genetic characteristics and growth estimates. And will these cases be restricted to America, or will they spill over to the rest of the world? Experts say it's too early to predict this. However, just 2 weeks back, the chief of the WHO, or as we call it, the China Health Organization, said that this subvariant has been identified in over 25 countries. Listen to this.
One of the Omicron subvariants originally detected in October 2022 is XBB.1.5, a recombinant of two BA2 sublineages. It's on the increase in Europe and the US and has now been identified in more than 25 countries. WHO is following closely and assessing the risk of the subvariant and will report accordingly.
25 countries, that's not a small number, and it could get worse if Americans don't show caution. And I don't say this without reason. Look at this headline. The Guardian carried it on Sunday. It says people are not taking this wave seriously. They are being negligent about the risk that it runs. And this has led to many experts issuing dire warnings. Take this one, for example. It has been issued by Dr. Stuart Ray, a professor of medicine at the Johns Hopkins University. He says, and I'm quoting, "The severe cases we are seeing are probably at least somewhat avoidable if folks make sure that they stay updated on vaccination, because that is still the safest way to gain immunity." Hospitalizations have not yet reached previous peaks seen earlier in the pandemic, probably due to immunity from vaccinations and prior cases, but that protection should not be taken for granted because immunity wanes. And this is not a standalone warning. The CEO of New Hampshire Healthcare Association has issued a similar alert. This is what he says. I'm quoting again. "Hospitals are at maximum capacity. I'm not sure what the trajectory of this thing is going to be, but I am worried." Warning number 3 coming from Neil Sehgal, an assistant professor in the School of Medicine at the University of Maryland. And this is what he says. "With XBB, there is such a significant transmission advantage that exposure is really risky. It's riskier now than it's ever been. I think the majority of people who are not masking today just don't know that they should." So with so many experts issuing these warnings, there is reason to believe that the scale of this crisis has not yet hit many Americans. And who is to blame for this? Well, we can think of only one man, and that is Joe Biden, the President of the United States. Do you remember what he said last year? Let me give you a quick recap. In September 2022, Biden declared an end to the pandemic. He said it was over and over for good. And this was despite America reporting hundreds of deaths every day. Let me quote the exact statement that he made in an interview. "We still have a problem with COVID. We are still doing a lot of work on it, but the pandemic is over. If you notice, no one is wearing masks. Everybody seems to be in pretty good shape, and so I think it's changing." I want to stress on the words that stayed with me. No one is wearing masks. Everybody seems to be in good shape. I think it's changing. Well, guess what? Nothing has changed. America is inching back to square one. According to wastewater analysis of the virus, this is one of the greatest surges of COVID-19 cases in America. Yes, it is lower than the peak in January 2022, but it's similar to the summer 2022 surge. The graph on your screen telling you the story, it shows how cases in the US are at their highest since January 2022. Now, I don't want to sound alarmist, but this is definitely concerning, especially given the situation in China. Do you know how many deaths it has reported? Over 60,000 in 1 month. I repeat, 60,000 Chinese citizens have died due to the Wuhan virus in just 30 days, give or take. And this has pushed the World Health Organization, or the China Health Organization, to seek more data from China on the outbreak. It has urged Beijing to show cooperation and transparency on the new cases. This is alarming as it is, and now the situation in America is only adding to the pile of concerns. What's worse, the corridors of power in Washington are not taking this seriously. Last we checked, they had not even acknowledged the surge in cases. Forget about imposing rules to bring it down. So where exactly are we headed? Are China and America about to infect the world? There is no easy answer to that question. WION now available in your country. Download the app now. Get all the news on the move.